Throughout the winter is usually when we see the RSV numbers increase, and we were seeing that in the outpatient setting. And for my colleagues, I don't know the numbers, but we're seeing that in the inpatient setting as well.
That's a Providence doctor talking about what local hospitals are seeing this RSV season. As parents look to protect their babies from the virus, the availability of the RSV vaccines are limited. A vaccine was just approved last summer. Marissa Rio shows us how this is impacting hospitals in Spokane County.
RSV is the #1 cause of infant hospitalizations, and we are currently at the peak of RSV season. While all of Providence clinics have the immunization available to patients right now, a physician says there has been times this season where they haven't had enough to meet the demand. Children are at greatest risk of severe sickness from RSV or the respiratory syncytial virus. There have been over 400 ER visits in Spokane County for RSV this season alone. Nearly 80% of those visits were children under 5 years old.
Their lungs become much more inflamed out to the really small airways, and so they sometimes struggle to breathe. They have increased work of breathing. They may struggle to eat because it's hard for them to breathe.
This is why the new vaccine was such a relief. The problem? There's a national shortage, so even if parents want to immunize their kids, they may not be able to.
We let the Department of Health know the demand we have, and then hope we get some response, meaning we get some numbers of the vaccine, as opposed to probably, and it's often not going to meet exactly what we're asking for, though.
The Spokane Regional Health District says supply in Spokane is dwindling, and the CDC is closely monitoring the supply. The Washington State Department of Health says it has just over half of the state's allocated doses still available. The big question, what are other ways to keep your children safe if the vaccine is unavailable?
It's just a reminder in the wintertime with a lot of these cold viruses, good hand washing, especially before eating, or if they're doing a lot of eye rubbing, that kind of stuff.
If you'd like to know if the vaccine is available for your child, Dr. Simmerman encourages you to call your primary care physician's office. Reporting in Spokane, Marissa Rio, 4 News Now.